the issue of health is a big and major concern. Our institutions, when you pay a visit to the average hospital, for instance, government hospitals, I should say, sometimes you meet a crowd of people there and you get to question, why would Nigerians have to go through all of this? We are facing other questions as a result of institutions as well in that sector. There's also the challenge of one doctor to about over 9,000 or 10,000 Nigerians. So let's get to x-ray all of this with someone who understands the workings of the health sector as we get to examine some of these issues this morning. We're joined this hour by Vivianne Ihekweazu, Managing Director, Nigeria Health Watch. Thank you indeed for joining us on the program this morning.
Good morning. Pleasure to be with you.
Yeah. So I'll begin with your reports. You seem to believe that Nigeria does not face a shortage of health institutions. You say the challenge with us is that we are unable to ensure that these existing institutions are adequately resourced, empowered, and the question of accountability. Tell us more.
Yes, absolutely. Good morning. We do have many health institutions and parastatals that have specific mandates in Nigeria. For example, the National Primary Healthcare Development Agency has a mandate for primary healthcare in the country. We've got the Nigeria Center for Disease Control, which oversees our preparedness for outbreaks. We have the National Health Insurance Authority, which actually is there to institute and ensure the mandate of health insurance is implemented. And we have the National Institute of Medical Research. So Nigeria has a plethora of parastatals and health institutions that oversee all of these functions. The question recently that we have seen is a series of bills in the Senate and House of Reps to have more health institutions, to have more parastatals. So, for example, there was a recent bill that was passed, or at least a recent bill that was put forward in the House of Reps for the National Agency for Malaria Elimination. As we all know, we already have a similar organ that operates within the Ministry of Health, which is the National Malaria Elimination Program, which already has the mandate. So the question being, do we need another institution to oversee the function of surveillance, overseeing preparedness, case management, vector control for malaria? So are we in need of further institutions to perform this mandate? In addition, another bill that was recently passed, the National Institute for Public Health and Infectious Diseases. We already have, as we know, agency, NCDC, that oversees the function of prevention, detection, and response to outbreaks in the country. So we do have existing institutions to perform these mandates. So the question really being asked is, do we need more institutions that will oversee these functions? And the risk is these additional agencies that are being put forward, they will now have overlapping function with existing institutions that we have. So the question really is, do we need more of these institutions?
And so it sounds like the argument of the Minister of Education, who had at a time, I believe after one Federal Executive Council, called on the National Assembly to suspend the concern of proliferation of universities where we have, a surfeit rather than, a deficit of universities already. I'm wondering whether you're as concerned about what is responsible for this, appetite for the establishment of agencies, parastatals, and how do we curb it? I know that we were huge on recommendations and call to actions today, but first of all, perhaps we should take a walk back to see where the problem lies. What's your theory about where this problem emanates from?
Okay, as many of us are familiar with, the 2012 Orasanya report that was commissioned by President Goodluck Jonathan was a very important landmark report that really looked at public health institutions across the whole country. And as we saw in the report, there were some recommendations that in order to streamline and reduce the cost of governance, we need to look at existing institutions, because at that time there were over 540 plus parastatals that were performing different functions. So really looking at what is the cost of governance, how are all these institutions working together? The recommendation at that time was to streamline existing institutions, to merge some into others, and to scrap some existing institutions. For example, within the health sector, we have some institutions that are focused on specific diseases, vertical programs. So one of the recommendations at that time was, for example, the merger of the National Agency for the Control of AIDS and the National Center for Disease Control. In that way, we're bringing all the disease programs under one roof. And similarly, there were other similar institutions that were asked to be streamlined. Because we also see globally a trend towards a need to consolidate institutions. For instance, within the UN system, the UN 80 program looked at, in 2025, the need to merge some institutions together, to sunset some. And this is all in line with making sure that agencies are working efficiently, that mandates are clear, and we're not having overlapping functions. As we know already within the health sector, many existing institutions suffer from a lack of funding, are underfunded, or very poor or slow budget releases. So the question really is this a proactive way of addressing issues? And is there a reason why we are seeing these bills being passed for more parastatals to be implemented and instituted in the country? So the Orasanya report was really a landmark report in 2012. President Buhari reviewed it and looked at whether it was to be implemented. And the current administration has pushed for the findings for the Orasanya report to be implemented. So really, this is where we are. So in view of that, these new bills, the question is there a gap that has been seen that existing institutions are not filling? With the current, with the new institutions, improve outcomes? And really, is this in line with public health reforms, as we saw in the Orasanya report? So really, when we are asking for more institutions, we need to really go back to what problem are we effectively trying to solve?
It's an interesting perspective you brought, and I'm sure the people that are creating these institutions will have maybe ready answers or not. So let's expand it with you. They say if it's not broken, why fix it? In your view and in your own analytics, for instance, so I don't know how many institutions are there and parastatals are there, to be very fair, in the Ministry of Health. So maybe you can help us with that data. What should be done going forward? Because if this looks like duplicity, if this looks like overlapping responsibility, if there are subunits within established agencies of government that are carrying out these responsibilities, and now they are pulling out those subunits within these agencies, or call it departments or whatever it is called, to now as a standalone institution or agency. First, we're talking about cost, like you've mentioned, personnel will come in. So playing the devil's advocate, do you think the idea is to strengthen it by giving it focus, or this is just interplay of politics and what is going on in terms of the Ministry of Health?
I think, we need to go back to where we are as a country, as it is within the health sector. We saw in 2025 almost the ground shift in Nigeria, but also across the region, when USAID, that historically has funded many of our vertical disease programs, really shut down. And we have seen what effect that has had. It has been, of course, a challenge in many implementation of many health interventions, but it's also an opportunity for us as a country and for us as a region across Africa to make sure that we are all responsible for funding our own health sector. So what we ultimately need to make sure we do is we have existing institutions. who have mandates to deliver particular functions. For example, I mentioned the new bill for the National Institute of Public Health and Infectious Diseases. That's proposed to be established in Zaria. What is the expected function of this institution? Because, for example, the Nigeria Center for Disease Control already has the mandate to implement what we call the international health regulations. And this is a binding agreement across countries on how you prepare, how you respond, and how you report infectious diseases. So, for example, we now see the Ebola outbreak in DRC. So the National Center for Disease Control has the mandate to oversee, if there was an outbreak in Nigeria. So if we now have a parallel institution, that will ultimately cause confusion between who has the responsibility for implementing the international health regulations, and it will slow down the response. So what do we need more than anything? We need to strengthen our current institutions. For example, we need to make sure that primary health care, which is really the foundation of healthcare delivery, needs to be effectively strengthened. The National Agency for Malaria Elimination they're trying to establish, this will have an overlapping mandate with the National Malaria Elimination Program. As many of us know, Nigeria has one of the highest burdens of malaria in the country. About 1 in 4 cases of malaria globally is in Nigeria. And NMEP has the mandate currently to make sure that we are strengthening surveillance or strengthening vector control, which is how are we making sure that we have effective mosquito control across the states? How do we make sure that surveillance is strengthened? So if anything, funding should be targeted at these existing institutions to strengthen their ability to respond to these very basic health issues we face. And underlying all of this is primary health care. If we're able to put more funding into primary health care, then every Nigerian will have the opportunity to get better quality care close to where they are. Because additional institutions are not the answer. But that's not to say that we do not need any. Because in assessing the health sector, we need to ask ourselves a couple of questions, which I mentioned. Is there an existing gap that needs to be filled? Is it that we're looking to improve outcomes? And if we were, why not strengthen existing? And also, how are we looking at how this will align with public health reforms? When we talk about a gap, incidentally, yesterday, there was a bill to establish the National Healthcare Facility Regulatory Agency. There is a gap there, because currently, the oversight of clinical governance in health facility, who makes sure that health facilities are delivering quality care. If someone says that they're opening a hospital, are there specific criteria that are being met? Who has the oversight to make sure that those health facilities are delivering quality care? So when we talk about new institutions, you can say that there is a gap because we do not have that oversight effectively implemented across the country. So it really requires all of us to look at what we currently have. Do we need more institutions, or do we need to strengthen and make sure that existing institutions are adequately funded?
Well, so I like the fact that you've mentioned our primary health care, and it's, for me, I mean, when you mentioned that and the issues at that level, I was really a bit concerned because I'm familiar with that setting. My mother is a retired matron, so I grew up in that environment. In rural areas, for instance, people at the villages, Nigerians at the villages, they prefer to go to what we call chemists than to go to the health centers. Over the years, that is gradually changing, but to a large extent as well, it looks like for those in the urban areas, they prefer to visit private hospitals rather than going to government hospitals. So I'm wondering in my mind if perhaps you and your team are making efforts to engage with the government, because you're not a politician, but for those in government, even though I know the Minister of Health is perhaps, some would say, a square peg in a square, what now, how is that hole? In a square hole. But sometimes when they get there, politics also interface with perhaps the profession. So are there efforts to engage with the ministry, the health sector, the Minister of Health, to put some of your concerns? I mean, you mentioned the Rosoya report as well, which started since the Goodluck Jonathan to Buhari and then to this current administration.
Yes, I mean, when I mentioned the commissioning of the Rasanya report, that was in 2012 by Goodluck Jonathan, and then Buhari now reviewed it, and then the current administration has sought to actually implement it, although to date we haven't had that streamlining of parastatals. But to your point, Kelly, about primary health care, the current administration, under the leadership of Professor Muhammad Ali Pateh, has, to their credit, put in place a sector-wide approach and also specific agenda items to deliver on improving health outcomes in Nigeria. A good example is the focused determination, as we've seen, which I'm not sure we have seen as much of in previous administrations, is really a desire to, for instance, improve maternal health outcomes, to strengthen immunization, because in Nigeria we have a lot of children who have never received a single vaccine. When we term these zero-dose children. So there is a desire to strengthen primary health care, but you make the assumption that it's only in urban settings that people are not using public health facilities. We know that there is a big gap, especially in the more rural areas, but also in urban areas. Primary health care, as I mentioned, as you alluded to too, is really the foundation of delivering any health service. So, for example, if a mother has a child with a fever, she suspects he has malaria, or the child, for instance, has diarrhea, the first place that mother or parent should go to is your local primary healthcare facility. But historically, we've seen that for many Nigerians, there is a desire, or people prefer to, maybe go to the chemist or to self-medicate. And many of the reasons are funding. We know over 60% of people access healthcare in private healthcare facilities, and over 70% of people fund their healthcare needs out of pocket. So when you're sick, you go and pay for healthcare. But we know that currently, health insurance is actually mandatory for everybody. The implementation of that has there's been a big push within the National Health Insurance Authority to ensure that many Nigerians actually have access to health insurance. Currently, only about 10-11% of Nigerians actually have health insurance. So financing and an ability to pay for healthcare often proves to be a deterrent for people seeking healthcare with skilled healthcare professionals. So we need to make sure that, if anything, we are putting a lot more of our resources into strengthening that very basic foundation of healthcare delivery, which is primary healthcare. And that needs to be done at in the rural areas, where we know that there are many issues and deficits in people accessing healthcare, but also in the rural area, in the urban areas, where healthcare delivery needs to be, yes, either in the public or the private sector, but people should never worry about the ability to pay. We talk about universal health coverage, where the ideal is everybody who needs healthcare can access it without being financially crippled, without a health emergency destroying the finances of a family. And we know that this is an issue for many Nigerians. So in order to ensure that we improve our health outcomes in Nigeria, more than anything, our resources need to be channeled into where they're needed, which is strengthening primary health care more than anything, but also educating Nigerians on the importance of getting health insurance, which currently is actually mandatory for all Nigerians.
Well, let me piggyback to some of the things that you had said earlier about the sector-wide approach and the projected outcomes. But what is a sector-wide approach without funding? And I'm referencing your report here, where you reference the Minister of Health and Social Welfare statement during the 2026 budget defense that only 36 million had been released from 218 billion naira capital allocation for 2025. And you emphasized earlier that perhaps if we need to create additional agencies in the first place, we should look at gaps. And you talked about the need for a regulatory agency to look at the efficiency of the health institutions that we have already. So in that regard, I'm asking what you think about the health facilities monitoring agencies that are found in some states, How effective are those? And perhaps is there a need for a regulatory agency that goes after the executive arm of government to demand the release of capital budgets for the efficiency of our health institutions? Is that what Ihekweazu can do at the state level? And, you know, can that be replicated, or do we have something like that at the federal level that is not delivering on the mandate?
Okay, thank you so much for that question, Bukola. I'm really glad you referenced Ihekweazu, because I think Lagos is probably one of the few states, and I think also Yobe, where there currently is a regulatory agency to oversee healthcare facilities. But across many other states in Nigeria, we do not have such regulatory agencies. And really, the function of those agencies would be to oversee clinical governance, to oversee public and private healthcare facilities, to make sure that the quality of care that's being delivered is to a standard. Because what we have currently are many healthcare facilities that deliver healthcare to Nigerians with varying standards, and there is no oversight. There is not significant or sufficient oversight to ensure that there's a standardized, framework that's used to measure the quality of healthcare delivered in health facilities. So the purpose of that agency will really be to oversee the clinical governance and quality of care being delivered. You mentioned also the sector-wide approach, which, as we have seen with the current administration, is really a push to make sure that there is a unified budget, there's a unified reporting system, and a unified discussion around health. Because previously, what we have found, especially where, as a country, I mentioned the dissolution of USAID last year, Nigeria has really historically been very dependent on donor funding, so exterior funds, to fund our healthcare sector. And typically, in the past, many funders would come with their own specific mandates or specific objectives, which is not really unified around a singular objective that the government of Nigeria, the Ministry of Health, is trying to deliver. So what the sector-wide approach is ultimately pushing to do is making sure that all those budgets are pooled into one envelope, into one bucket, so that there is a unified approach to delivering on the objectives and the mandates of the current Ministry of Health. So really what that sector-wide approach is really pushing to do is pulling all funders together to make sure that we have a unified approach to really deliver on the 4-point agenda of the current Ministry of Health, the current health administration.
I'm always looking at the monies and earmarks when it comes to these things. So let's talk about the way forward as we begin to wind down. If you were to sit with Professor Lipate and all of those who legislate via the National Assembly and tell them, I know you've made some of those comments in passing whilst we're asking you questions. What agencies would you want them to scrap as soon as yesterday? What would you want them to discontinue in terms of a proposal on their table in terms of another set of agencies? So let me leave it at those two.
Okay, it's a very good question, because the landmark Orasanya report, I think, has done that audit. Then I think there were over 540 plus parastatals. By now, I'm sure there are a lot more. The exact number I don't know exactly, but if we were to have any more agencies, there are critical questions, as I mentioned, that we need to address. Is there an existing gap that needs to be filled? The current outcomes of the existing agencies, is it that there's a problem of implementation? If it is, then we need to strengthen it? And really going back to public health reforms, as outlined in the Orasanya report, what are the current agencies that we have? The ones that have been recommended for streamlining, sunsetting, whatever, how is that currently been implemented? Because it was a very detailed report and detailed audit. So if anything, we don't need to reinvent the wheel. We just need to really go back and look at what were the recommendations of that report, what needs to be done going forward. But more than anything, our current institutions, our current health agencies, are they able to perform their mandate in an effective way? Do they have the necessary staff workforce? Do they have the necessary budgetary allocation that's released on time? Because there's one thing about allocating a budget. Is the budget released on time to improve a lot of the poor health outcomes we have in Nigeria? So the question is not, do we need to create more? The question is, what have been the recommendations of the report? We need to go back to them and really look to make sure that we as a country are able to have a health sector that delivers for the people of Nigeria. And all Nigerians have access to quality healthcare, which we know is actually a right.
Well, I think we have to leave it here. It's been an interesting conversation with you, and we hope that the government is listening and they will indeed implement that particular report, because since it was started somewhere when Goodluck Jonathan was president to Buhari, and now to the current administration, which is already about 3 years in office. But we'll just keep spotlighting these burning issues in the health sector. Well done to you and your team, and thank you indeed for stopping by our studios. Vivianne Ihekweazu is the Managing Director, Nigeria Health Watch. Thank you indeed for your insights of the program this morning.
Thank you very much, Kelly, and to your team. Thank you.